PowerLINZ is an antimicrobial antibacterial evacuation line cleaner. This is an excellent solution for disinfecting and cleaning after surgeries or bloody procedures, as well as in between patients and end-of-day cleaning. PowerLINZ comes with a pre-measured pump for ease of use. To use PowerLINZ as an end-of-day cleaner, let's make the assumption that we are cleaning 2 chair practice. Step 1. Add 1 pump of PowerLINZ into 1 liter of warm water. This will clean 2 chairs. Step 2. Set the high volume and the saliva ejector into the mixed solution. Step 3. Turn on each line, suctioning roughly 400 milliliters of the mixed solution. Step 4. Turn off evacuation lines. Step 5. Pour roughly 100 milliliters of the mixed solution into a cuspidor. If there isn't a cuspidor, suction all 500 milliliters in Step 3. Step 6. Repeat steps 2 to 5 for second chair. Unlike clean lines, PowerLINZ can be run through your operatories during any part of the day and does not require to sit in the lines. PowerLINZ can also be pre-mixed and last up to 7 days while pre-mixed. This brings us to the other way PowerLINZ can be used, which is in between patients. There have been studies to show many patients experience backwash when they close their mouth over the suction line. In the first few inches of a suction line is the previous patient's saliva. When a suction line is introduced into a new patient's mouth, the first reaction of the patient is to close their mouth. This causes a negative vacuum backwashing the previous patient's saliva into the new patient's mouth. M.A.R.S suggests having a liter of water at every operatory with 1 pump of PowerLINZ. As the patient enters the operatory, have the office staff trained to explain to the patient, "Please have a seat. I'm purging and disinfecting the suction lines from the previous patient." The staff member will then suction roughly 50 milliliters per suction line. This will purge the saliva and disinfect the lines. A liter of mixed solution should last each operatory at least a day. In many cases, there will be 250 milliliters to 500 milliliters left of the solution. The remainder of the solution can be used as the end-of-day cleaner. By using PowerLINZ as an in-between patient cleaner, M.A.R.S believes using our method will be a value-add marketing program for your practice. Most dental clinics do not clean in between patients. If your practice adopts the M.A.R.S method, your patients will not only appreciate the extra effort to protect their health, but if they were to leave your practice and use another dental clinic, and that clinic does not use the M.A.R.S method, it will certainly be made obvious to the patient that your practice cares more about their health, and they will likely be returning to your practice for services again. Thank you for being a part of the M.A.R.S family. If you were to have any questions on any of the M.A.R.S environmentally friendly product lines, please do not hesitate to call us at 1-866-594-3648. Or please check out our distributor page at MarsBiomed.com to speak to any of our M.A.R.S certified experts regarding any of your amalgam separator or evacuation line cleaner needs.